Hi, welcome to another edition of Dr. D's Research Review. This is actually an addendum that we just did on obesity, which talks about or speaks to the premise that, again, obesity is an effect, it's not a cause. The cause of obesity is driven by inflammation, endocrine disrupting chemicals, and cortisol, which is stress. And we are in an environment, a toxic environment, which has inundated our bodies with endocrine disrupting chemicals, which then cause insulin insensitivity, which then leads to diabetes, which obviously leads to glycemic dysregulation, which then leads to obesity. All of that is caused by endocrine disrupting chemicals combined with inflammation. However, this study, which is interesting, and again, the title of this study says this: obesity adds decades of diabetes and cardiovascular disease, and it shortens your life. And what I find to be interesting in this article, other than the fact that just 10 pounds of fat loss, just reducing 10 pounds of fat loss, can reduce your risk of diabetes by 60%. Again, why? Because fat is inflammatory, cause and effect. But what's more interesting to me and what I want to get through is so many times I do consultations and people say, oh, my doctor says I'm not diabetic yet, I'm in pre-diabetes. What this article in the body of the study is saying is that pre-diabetes is just as dangerous as diabetes. It's just a matter of degree. It's not like you're in a pre-diabetic state and so therefore you're healthy and all of a sudden you go into a diabetic state and the light switch is on and all these comorbidities occur. No, that's not the way it happens. You actually have increased risk of cardiovascular disease, dementia, and shortened life by being in a pre-diabetic state. So in my world, there's no distinction between pre-diabetes and diabetes. It's just a number. What we're measuring is something called hemoglobin A1C. And so what many doctors will tell you is between 6'2" and 5'6", you're in that pre-state. Anything over 6'2", you're full diabetic. Well, guess what? You have already lost 50% of insulin function if you're in that pre-diabetic state of 5'6" to 6'2". So that's not a good place to live. Why? Because insulin is inflammatory, and inflammation is what drives things like obesity, cancers, dementias, depression, and so many, high blood pressure, and so on and so forth. So let's deal with this thing. If you're in a pre-diabetic state, it's time to take action now. You do not want to wait until you're off the cliff of disease. This is the time to start. If you want more information, please call our office and come to one of our next seminars on endocrine disrupting chemicals and its relationship to how it causes and affects your diabetes risk factors. Until we meet again, have a blessed holiday season.